Relationships between cancers and visceral fat, food and exercise. Number 1220, VMT Sharp 606, February 6, 2025. By Gerald C. Shu, EclaireMD Foundation. Category Oncology. Abstract. Key message: the correlation between cancer risk and visceral fat, VF, is 71%, while the correlations between VF and food portion, exercise range are 66% and -47% respectively, in the spatial diagrams generated using the neural network method. NNM, the outlier data points within these three data distribution clouds represent critical, but less frequent cases that contribute significantly to cancer risk. The viscoplastic energy analysis revealed the VMT energy contribution ratios of these three influential factors to his cancer risk as follows: visceral fat, VF 49%, food portion, M9A 24%, exercise, M5 27%. This VMT energy finding further reinforces the critical importance of reducing belly fat as a key strategy for cancer prevention and overall health. Description: people with high belly fat, visceral fat, or VF, have a significantly higher risk of developing cancer due to inflammation, insulin resistance, hormone imbalances, and metabolic dysfunction. Reducing visceral fat through a combination of healthy diet, starting from a tight food portion reduction, and persistent exercise, is an effective strategy for lowering cancer risk and improving overall health. Individuals with high belly fat, visceral fat, VF, indeed have a higher risk of developing cancers. Why does high belly fat increase cancer risk? 1. Chronic inflammation. Visceral fat is metabolically active and produces pro-inflammatory cytokines such as TNF, alpha, IL-6, and C, reactive protein, CRP. Persistent low-grade inflammation damages DNA, promotes tumor initiation, and accelerates cancer progression. 2. Insulin resistance and hyperinsulinemia. High belly fat leads to insulin resistance, causing elevated levels of insulin and insulin-like growth factor 1, IGF-1. Insulin and IGF-1 stimulate cell proliferation and inhibit apoptosis. Program cell death, promoting cancer growth. 3. Hormonal imbalance, estrogen and androgens. Visceral fat contains aromatase, an enzyme that converts androgens into estrogen. High estrogen levels increase the risk of hormone-sensitive cancers, such as breast, endometrial, and ovarian cancer in women. In men, excess belly fat reduces testosterone levels, increasing the risk of aggressive prostate cancer. 4. Oxidative stress and DNA damage. Visceral fat generates reactive oxygen species, ROS, leading to oxidative stress. DNA mutations caused by oxidative stress can trigger uncontrolled cell growth, increasing cancer susceptibility. 5. Gut microbiome alterations. Obesity and visceral fat disrupt the gut microbiome, promoting chronic inflammation and production of carcinogenic compounds. This is particularly linked to colorectal cancer. Which cancers are most linked to high belly fat? 1. Colorectal cancer, strongest link due to gut microbiome changes, inflammation, and insulin resistance. 2. Breast cancer, postmenopausal women, increased estrogen and insulin drive tumor growth. 3. Endometrial cancer, excess estrogen from visceral fat increases risk. 4. Pancreatic cancer, insulin resistance and chronic inflammation contribute to its development. 5. Liver cancer, hepatocellular carcinoma, HCC, visceral fat is associated with non-alcoholic fatty liver disease. NAFLD, a precursor to liver cancer. 6. Esophageal cancer, belly fat increases acid reflux, GERD, raising the risk of Barrett's esophagus and esophageal cancer. 7. Kidney and gallbladder cancer, linked to metabolic syndrome and chronic inflammation. 8. Prostate cancer, aggressive forms, excess belly fat is associated with higher grade, more aggressive prostate tumors. In summary, the author analyzes the relationships between his cancer risk and visceral fat percentage. VF percent, food portion, M9A, and walking exercise, M5. The correlation between cancer risk and visceral fat, VF, is 43%, while the correlations between cancers versus food portion and exercise are 66% and -47% respectively. In the spatial diagrams generated using the neural network method, NNM, the data clouds for both cancer versus VF and VF versus food portion, M9A, are inclined from the lower left recent years to the upper right, earlier years, indicating a positive correlation. The outlier data points inside of those outskirt areas of these three data distribution clouds are particularly interesting and valuable for further analysis, as they may help identify high-impact, cancer-related patterns associated with VF, food portion and exercise. Although less frequent, these outlier cases may have greater severity in terms of magnitude and effect on cancer risks. To gain a macroscopic view of the influence of these three factors on his cancer risks, the viscoplastic energy method, VMT energy was applied. The VMT analysis revealed the energy contribution ratios of these three factors to cancer risk as follows: visceral fat, VF 49%, food portion, M9A 24%, exercise, M5 27%. Although VF is only one of many contributing factors to cancers, its dominant influence, compared to the other two major lifestyle factors, highlights its significant role in cancer risk. This finding further underscores the critical importance of reducing belly fat for cancer prevention and overall health.